Our first speaker today will be Jason Malone, who is Director of the Human Subjects Division at University of Washington. He'll present a brief overview to start off the session and the panel, and then we'll introduce the panelists afterwards.
Great, good morning. Thank you for the introduction. Let me share my screen here. Can you all see my slides okay? Great. Well, good morning or good afternoon, depending upon where you are. So my name is Jason Malone, Director of the Human Subjects Division at the University of Washington. And I was asked to speak today about the injury compensation program that we've been using at the University of Washington here for almost about the past 40 years, although it's evolved and changed over time. So my goal is just to share a little bit of information about how the program works, and what it does and doesn't cover. Give you a little bit of historical background about how it developed, and then talk about a few of the challenges that we face with this program. In terms of background of about the university itself, we are one of the largest publicly funded research institutions in the United States in terms of sponsored grants and contracts, about $1.67 billion in funding, at least in fiscal year 22. Our research encompasses not only our traditional campus locations here in Washington State, but we also have research occurring that's led or sponsored by the university at partner institutions in the area and places across the United States and internationally. We have a large human subjects research portfolio, but actually only a very small percentage is made up of high-risk interventional clinical trials. So you can see the numbers here, maybe only about 4 or 5% fall into that category. And then we do have a percentage of our research that we do seed out and rely on external IRBs for review and oversight. So our injury compensation program is called the Human Subjects Assistance Program, or HSAP, and it is basically a no-fault discretionary program that offers compensation for injury or illness to study participants who experience what we call a qualifying medical problem, and I'll define that in a bit. And that problem has occurred as a result of their participation in UW research. So under that program, we are able to waive charges for injury-related treatment that occur at a UW care facility up to $250,000. We also can provide reimbursement for out-of-pocket expenses for healthcare that's provided elsewhere, so at a non-UW facility or other sorts of care-related expenses up to $10,000. And then, of course, we have a more generic clause that gives us flexibility in terms of being able to provide additional expense or assistance as agreed upon between the study participant and then our UW Office of Clinical Risk Management, which is the office that administers the compensation. What the program does not cover, though, are lost wages, lost time, or pain and suffering. It doesn't cover expenses that are covered by other programs like the National Vaccine Injury Compensation Program or compensation that's provided under the Public Readiness and Emergency Preparedness Act, or any expenses that would be covered by a national healthcare system in countries outside of the United States. So one thing that both our researchers and others get confused about is the applicability of the program, and that it is based on the event and not necessarily the study or the location of where the study is occurring. So what we call a qualifying medical problem that occurs as part of UW research, even if we're in an international setting, could be eligible for this program. In order to be a qualifying medical problem, it has to be a physical or a psychological disorder that's diagnosed by a healthcare provider, has to occur during the course of UW conducted research, has to be research related. There needs to be some sort of recognized treatment, something that can be done that someone would be seeking compensation to cover that treatment. And it has to be reported to us within 1 year or less of when the event or the causality of the event is identified and the reporting. And then obviously, of course, it has to be part of a human subjects research study for which the UW is engaged. I mentioned before that we do send some of our studies to other IRBs for review. This program also would cover events that occur even if we're not the IRB of record, so long as it meets the other applicability requirements. The types of events that would not be covered by the program would be medical problems that are just sort of, natural progression of the underlying disease or condition, any sort of standard of care treatment that the person is undergoing for their disease or condition. If there was substantial or deliberate noncompliance on the part of the study participant to follow the research procedures or instructions, and that was what led to their injury, those might not be covered under the program. And then problems that are associated with study procedures that are not under the direct control of a UW agent. So if, for example, the research study contracts out with a third party to do at-home blood draws and a patient suffers an injury as a result of that incident, the program would not cover those expenses. It'd be expected that the third party's liability insurance would cover that. And then industry-funded or initiated research is not covered under the program, in part because as a publicly funded institution, obviously the monies used to provide this compensation are coming from the public, and so it felt it was sort of unethical to be using state public funding to support events that arise from a for-profit company's trial for which they're going to receive that benefit. So instead, what the university does is, as part of its establishing with contracts with those pharma companies, make sure that there are clauses within the contract for the industry sponsor to cover any research injury. So although there are a number of components of our institution that are involved with this program, the two primary offices that manage this program are our own, the Human Subjects Division, and then our university's Office of Clinical Risk Management. For our office, our primary responsibilities include just sort of assessing upfront the potential for events to occur within a given study. So, is this a greater than minimal risk conventional trial where there are known risks, or is this, a simple minimal risk survey study or record review study? That sort of upfront assessment helps us decide whether or not the language about the program and making sure participants are aware of it should be included as part of the informed consent process. So after that assessment, we make sure that language is in there. We are the office that receives the initial intake of the reported events. I would say most of our events have been reported by the researchers themselves, but we have had some circumstances where a participant has reached out directly asking for compensation, so they can come in through either way. We do the initial assessment to determine whether or not the event meets the criteria for coverage, and then we report that over to our clinical risk management office. That office is the one that makes the final determination of eligibility, and then they are the ones who are responsible for administering the program benefits. For some history of the program, it's been around, as I said, for a while, almost 40 years. Back in the 70s, the university had actually an insurance policy that they had purchased from an outside company to cover compensation for injury claims. And over a 6-year period, they did an analysis of the total claims that had been paid out versus the amount that they had paid in insurance premiums. And as you can see here by these numbers, the amount they were paying in insurance premiums was significantly higher. And so in 1979, the university decided to establish its own program, which is what is now called HSAP. At that time, the program was just limited to covering expenses of up to $10,000 for out-of-pocket reimbursement for treatment. But over time, the program's been expanded to include the other components that I mentioned in terms of writing off medical bills for treatment that occur at our own facilities, putting in the qualifier of the time frame in which the events need to be reported, and then, of course, expanding our definition of what constitutes a qualifying medical event. Some of the challenges I think that we still face with this program is probably the most biggest one is access. The burden of reporting is on either the researcher or the study participant to identify and report to us. It's made aware in all of our consent forms, but despite that, we receive very few reports. I think within the last, 4 or 5 years, our office has received maybe only 9 or 10 requests or claims on this program, which to me seems small considering the amount of research we do, and that, you know, certainly injuries happen as a part of research. So I think access is a big issue. Determining the coverage boundaries, you know, more and more researchers are collaborating with different research partners, and so it can be very difficult to sort of tease out who's actually responsible for the event and should provide compensation for injury or illness. Determining causality, of course, is always an ongoing issue and challenge. Although not particularly a challenge for us at this point in the sense that we have so few claims, funding could be an issue potentially because, as I said, this is sort of a program that is funded internally by the institution. So it relies on the university and the writing off of expenses by our medical system to provide this coverage. So right now with the low usage, that's not an issue, but funding might be an issue if we sort of suddenly saw an increase in claims. And so that's our current injury for illness program. So thank you for your attention.